अस्सलामुअलैकुम। मेरी आवाज़ क्लियर है क्या? हेलो गाइस, रिस्पॉन्ड प्लीज।
वालेकुम अस्सलाम। हाँ, क्लियर है भाई।
थैंक्स, थैंक यू वेरी मच।
हाँ, माई साइड कोई है ना शेयर करने के लिए पीपीटी? हेलो।
Yes, Afiyadi will do it, inshallah.
ओके ओके। जजाकल्ला।
Assalamu alaikum. We will be starting in a few minutes. Assalamu alaikum wa rahmatullahi wa barakatuhu. Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa barik wa sallim. Respected panelists and beloved batch 2022, I, Kashif Ahmad of Usmania 23, will be the host for today's session. A very warm welcome to each and every one of you to the session we all have been eagerly looking forward to, the second part of the final lab, MBBS final year guidance session, organized by the Academics Committee of IMSA. Beginning the session with the Quran, I would like to invite Brother Saifur Rahman Ansari of Usmania 24 batch to recite a few verses from the Holy Quran. May Allah subhanahu wa ta'ala fill our hearts with peace and light through His words. Ameen.
السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. قال رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي واجعل لي وزيرا من أهلي هارون أخي أشدد به أزري وأشركه في أمري. My Lord, expand for me my chest, and ease for me my task, and untie the knot from my tongue, so that they may understand my speech, and appoint for me a helper from my family, Harun, my brother. Strengthen through him my strength, and let him share my task. The tafsir. These verses are part of the beautiful dua of Musa alayhi salam when Allah subhanahu wa ta'ala gave him the enormous responsibility of going to Firaun and calling him towards Allah. Musa alayhi salam knew that the task was difficult, so instead of relying upon his own abilities, he turned to Allah subhanahu wa ta'ala first. He asks Allah to expand his chest, to give him courage, patience, tranquility, and strength to face what lies ahead. He then asks Allah subhanahu wa ta'ala to make his task easy, teaching us that even when we have prepared and worked hard, we should still seek Allah's help and facilitation. He asked Allah subhanahu wa ta'ala to remove the difficulty from his speech so that people can understand him. This is especially significant. His concern isn't simply let me speak well, but let them understand what I say. The purpose of knowledge and communication is therefore not to display what we know, but to make it understandable and beneficial to others. Finally, Musa alayhis salam asks for Harun alayhis salam as a helper, showing us that important responsibilities do not always have to be carried alone. Good people around us can strengthen us, support us, and help us fulfill our responsibilities. Jazakallah khair.
Subhanallah, that was truly soothing to the soul. Jazakallahu khair for that heartfelt recitation, Brother Saif. Before we proceed further, let us make a brief dua together. And we ask Allah, Allahumma anfa'na bima 'allamtana wa 'allimna ma yanfa'una wa zidna ilma. Ya Allah, benefit us with what you have taught us. Teach us what will benefit us and increase us in knowledge. Ameen. May Allah subhanahu wa ta'ala make the Quran the light of our hearts, the guide for our lives, and grant us beneficial knowledge through today's session. Ameen. This session is brought to you by IMSA, Initiative of Medicos for Service and Academics. IMSA is a non-profit initiative by medical students across Telangana, driven by the belief that medicine, when practiced with faith and service, becomes a meaningful act of worship. May Allah bless everyone working behind the scenes to make this session possible. Building on the incredible momentum and insights from yesterday, where we covered ophthalmology, general surgery, and pediatrics, tonight we shall be completing the final lab. Today, we dive into the remaining core pillars of the final year: general medicine, obstetrics and gynecology, and ENT. Our panelists are our seniors who have not only excelled academically but have also generously volunteered their time to guide us with strategies, important topics, revision techniques, and practical exam tips that will help us prepare efficiently for our professional exams. Without further delay, it is my privilege to introduce today's distinguished panelists. Our first panelist is Dr. Muhammad Salman, Shadan Institute of Medical Sciences, Batch 21. Sir has secured a distinction in obstetrics and gynecology, and inshallah, he will be guiding us to inarguably the most important subject of the final year: general medicine. Please join me in warmly welcoming him.
Assalamu alaikum wa rahmatullahi wa barakatuh. Am I audible?
Yeah, you're audible.
Okay. Again, a warm welcome to everyone present here. It's really good to see that you have attended the session again, having already attended the session yesterday. So hopefully, inshallah, today I'll be walking you through the subject of general medicine. And hopefully by the end of the session, it'll feel less scary and dreadful for you. Please note that I've tried my best to include an overview of everything that is relevant and important for you as a final year student. But the subject is vast, and you simply won't be able to do justice to it in less than 20 minutes. So before we begin, let me start with a question. I believe many of you have already started preparing, and some of you may have even had your first internal examination. How did you prepare? What resources did you use? And more importantly, what challenges did you face while preparing? Just let me know in the chat box. Okay. So first starting with the resources, most of you might already be familiar with these books. You have Ajit Balur, then there's Manipal Exam Preparatory Manual and Davidson. I'd say basically that Ajit Balur, in my opinion, is everything that you need as a final year student. The toxicology section does have a few types of poisoning missing. So only for that you can refer to the Manipal
हाँ,
exam
आपकी आवाज थोड़ी
manual.
तेज
Apart from that, Balloon has a lot going for it. The tables, diagrams, clinical examination findings, and much more. And I think it is more than sufficient for your preparation. Manipal is also commonly used by many students. However, personally, I don't think you'll have the same level of satisfaction. Okay, I'm back. Am I audible now?
Yes, Bhaiya.
Okay, sorry for the disturbance. So yeah, like I was saying, Davidson's is really good book to understand the concepts and mechanisms and everything. But you really don't have that much time at hand, especially now that you have two additional subjects to deal with. So you can skip it altogether if you're short on time. And when I say that you shouldn't be chasing Davidson, you need to think about Harrison's. Harrison's is simply beyond what is required for you as a final year student. It contains very detailed explanations, lengthy discussions, and even pharmacology and treatment principles are explained at a molecular level. I had read a few topics from Harrison's before my final year had started, particularly hematology and gastroenterology, but it wasn't easy. So don't let anyone make you feel guilty about not reading Harrison's. You don't really need to read Harrison's to clear your exams or even to become a good physician. Now, coming to the Olympic YouTube channels that I've been following since a long time now. First, you have Medi Lectures. It has summaries based on Harrison's, and this is something that I personally liked. I benefited from it when trying to understand the subject, and it's definitely worth giving a try. Next, you have JJ Medicine. It covers more than just general medicine, it has other subjects too. Uh, they usually start with the definition and explanation of the conditions in simple terms. Then they move on to explain the pathophysiology and so on using clear sightings. So the structure is almost like an exam ready answer format. So once you start watching lectures from JJ Medicine, you'll realize that everything that they explain is, almost, like an answer that you would be presenting in your exam. And it also uses images and visual aids to help you understand the concepts better. So definitely check it out. The third channel here, however, Fox Stereo, which I had found about a year ago, it can genuinely make you fall in love with the subject. But it is run by two physicians with PhDs in medicine. So I leave it to you to guess the level of depth and knowledge it offers. And it is also more inclined towards USMLE preparation rather than university exams. Nevertheless, I'd say it is highly underrated channel and definitely worth exploring if you enjoy going deeper into the medicine. Next, there's Zero to Finals. This channel also covers more than just general medicine. So you can also study orthopedics, CNT, and the other subjects from this channel. Disease. It also uses useful pointers and associations to help you remember things better. Next, Ninja Nerd. I believe that almost every one of us knows Ninja Nerd. So they don't just have good lectures on microbiology, pharmacology, or first year subjects. Even as a final year student, if you're finding it difficult to understand something directly from the textbook, you can just watch the lecture from Ninja Nerd. It is equally good, I'd say. Lastly, for rhesus medicine, it is also good and it offers a little more depth and also has dedicated lectures on topic like urinalysis and LFTs. So the topics that are often overlooked by many students while preparing, but which still can appear in your exams. And it also has good visuals and images. So I think it is particularly useful for understanding concepts. So even if you're short on time, I'd say that you go through the Medi lectures, JJ Medicine, and Zero to Finals. Rhesus Medicine has really good lectures on EKGs. So if you're finding it difficult to understand the EKGs, then Rhesus Medicine is something that you should try. Coming to the online resources, if other resources, if you have already subscribed to a NEET PG preparation platform, you can also follow the medicine faculty. You have Dr. Tamim Saif sir from Dr. Bhatia, then Dr. Deepak Marwa for PrepLadder, and Dr. Rakesh Nair from Marrow. All of them are equally good. DBMCI and PrepLadder are usually preferred by many students because Marrow, on the other hand, goes into a lot more detail in general medicine, which can be difficult to finish, especially if you're starting now as a final year student. Let alone remember and retain everything that you've studied. So, what about notes? Now, I'm not really a big fan of notes, and I generally don't recommend studying from notes for your final exam. There are mainly two reasons for this. Firstly, there aren't many good notes available for general medicine that can really do justice to the subject or help you understand, everything that is important for your test. Second, you simply won't get the same level of satisfaction or the same level of depth of understanding that you would get from studying a good book. Notes are supposed to help you cover or revise certain topics quickly before an exam, especially when you haven't read them before and simply don't have enough time to prepare from a textbook. But if you go directly to the notes without even trying the textbooks, I'd say that you're limiting your potential, settling for less, and it is just not good for you. If you really have to use notes, however, I'd recommend JTM notes. Uh, there isn't really, other good source that I know of, especially for general medicine. Now, I think again, many of you already know this. This is the division for your exam, for your theory exams. So you can see that paper 1 and paper 2 have certain topics which might overlap. There is always a variation of 10 to 15%. And remember that the university doesn't always follow this pattern strictly. Sorry. So like I was saying, here I'd also want to burst a common myth that paper 2 part B has 50% of respiratory medicine and remaining 50% is divided between psychiatry and dermatology. So you might get a long question from another chapter altogether. It is not necessary that 50% of the part B is going to be from respiratory medicine. Just a minute, I'll try changing my screen. Okay, sorry for that. Like I said, respiratory medicine doesn't necessarily carry 50% of the weightage for your part B. A question can come from anywhere. This is what has happened for our batch, 21 batch. So be prepared for that. there were many who had studied respiratory medicine since the beginning, hoping that it will at least help them cover 15 marks question, but not even a single question appeared from respiratory medicine. So if you have this prefix notion that certain weightage is going to be followed by the university strictly, then you're setting yourself up for disappointment. So now, addressing the elephant in the room, why does medicine feel so difficult? So obviously you have the vast syllabus and everything requires understanding and recall. Then this huge amount of drugs and management and everything is interconnected. Then it is also difficult to translate your knowledge into answers. You might be knowing a topic really well. You might be able to explain it to your friends, but again, when it comes to writing it in the examination, it becomes difficult for you to present everything that you know. Then there is also theory plus clinical integration. Even in the theory exam, you're supposed to write, at least a bit of clinical findings that you would, only know about after seeing the patient. But having said that, there are also several things working in your favor. You don't have to memorize every single thing independently because medicine is highly interconnected and conceptual, and clinical reasoning obviously helps you retain it for longer. And there are many diseases which follow predictable answer structures, which I'll be explaining in the upcoming slides, inshallah. Then management can also be organized into simple algorithms. So you need not spend a lot of time memorizing each and every drug that goes into managing a particular condition. Then obviously, like any other system, any other chapter out there, patterns repeat. There are certain conditions in a system that have repeating patterns, especially the rheumatology part. So autoimmune conditions, you'll see that certain kind of antibodies are positive in a lot of clinical conditions. So now that you know where to read from and how to read it, obviously PYQs have to be your base, but you should not blindly follow PYQs. I'd say that you use this 3T strategy. That is, divide all your PYQs into 3 categories: the must know, should know, and good to know categories. Must know are the topics which you really cannot, afford to leave. Then should know, you should cover once your core preparation is secure. And good to know are the topics which are not that frequently asked in the examination. But if at all a bouncer comes, then it will help you, take the fall. It will help you break your fall. So these are just a few topics which I have included, but you can go through the PYQs to make your own list. So in the should know topics, the absolutely necessary ones, you have your MI, acute coronary syndromes, diabetes, stroke, pneumonia, cirrhosis, and many other. Must know, are just like the main topics, but these are not that frequently asked. Then in the good to know topics, these are the conditions which are not that commonly asked, but are still clinically relevant. So there are a lot of diseases and conditions in the medicine. So how do you even start understanding the diseases? So just like any other subject, you have to start with the definition because definition is sometimes asked. So definition, then there's etiology. For certain conditions, they'll ask you about classification. Example for epilepsy, they can ask you about the classification of epilepsy. There's grand mal, petit mal. Then there are, focal seizures and everything. So that kind of classification. Then clinical features and everything you already know about. What I want you to take from this slide here is that investigations, management, and complications, you have to focus a bit more on these aspects. For investigation, now that you have entered your clinical subjects, it will go beyond the simple investigations. Instead of just randomly writing any investigation that you know about, you need to understand what is going inside the body whenever a person suffers a clinical condition. Then you can target your investigations to come to a diagnosis. And then the same goes for the management. I think you already know this. For complications, obviously there are acute and chronic complications, which I will be explaining further. So disease management, again, like I said, don't just collect facts. Ask yourself what is happening, why it is happening, and how do you treat it. Example, I've just given one example here, like for heart failure, there is reduced cardiac output and decreased renal perfusion. So you have your RAS activation, sodium water retention, and everything. You target your therapies according to what is going wrong in the patient's body. Next slide, please. So here's another example. The PPT will be shared with you, so I'll just quickly brush up. In diabetic ketoacidosis, again, you have a lot going on. There's metabolic derangement. So to come to a certain diagnosis, you need certain investigations. You'll obviously do plasma glucose because there is hyperglycemia, ketonemia, ketonuria, and everything. So you run all these tests, which will help you come to a diagnosis. But before initiating the patient on treatment, you'll again have to run some other tests. You have your RFTs, urinalysis, and everything. Then once you know that the patient has diabetic ketoacidosis, you need to ask yourself, how severe is the condition? Can you just manage the patient conservatively, or do you need to take certain precautions? So for that, you can check patients, mental status to see if there are any focal deficits, blood pressure, heart rate, and the degree of dehydration, everything. So it is just a template, and you can use this for any answer or any topic that you're studying. The same goes for the management. Like I said, I think by now you're already used to writing answers this way. In his management, you have your conservative management and the specific management, general your ABCs and everything. Then apart from specific management, if the patient has already landed in complications, you'll need to initiate the patient on emergency treatment. So it is a bit different from the specific management. You have to be careful about that, because sometimes in the examination, they don't just ask about the usual treatment of the condition. They give you a clinical case scenario, and they give you that the patient, is suffering from certain complications, and you'll have to treat that complication. You need to explain the treatment of that complication, not just the treatment of the disease condition. So you can just go through this later. Now that you know where to study from and how to study, how do you translate your knowledge into marks? There are students who know really well, but they're unable to score well. Because most of the times what students do is they only practice, they only read the questions. They only read the PYQs or the notes directly from the textbook, and they never practice writing it down. And when you have not practiced writing in the examination, you have all the knowledge sitting right in your brain, but you're unable to represent it beautifully on the paper. Or let's say if you haven't spent enough time revising things, then what happens is in the exam, your entire focus is on recollecting the facts that you have already forgot. So you get little time to pay attention to the presentation and details. So eventually you end up losing marks. So I'd say that repeatedly revising and practicing the topics will help you remember things easily in the examination. It will come to you naturally, and you can focus more on your presentation rather than having to pay attention to the details that you've already forgot. So after covering your theory, again, final year practicals will be a bit different from your preclinical and paraclinical years, because now that you've entered the clinical subjects, the examiner will expect a bit more details from you. So if you're not scoring, theory marks are not really in your hand. No matter how well you prepare, a question might appear that you haven't read well. So what you have in your hand is your practical marks. So, give it your best, study really hard for your practicals so that your overall score increases and the chances of you scoring a distinction increases. So these are the books that I've displayed. You can just go through them. Hutchinson is commonly followed by many students, but I was told by a professor that Hutchinson is not really required for MBBS student as such, because there is just way too many details for a student to be able to remember. So you can either refer to MacLeod or Archit Balur. I think either of this book is really good. And for the general medicine specifically, the White Army is a really good channel. You can just look it up in the YouTube. They have clinical case presentations with Dr. Archit Balur. So for your long cases in your practicals, you'll be given a case from maybe, let's say, hemiparesis, hemiplegia, or any other case that you will have to present. So the White Army channel has a student presenting these cases, and the one, the examiner is Dr. Archit Balur himself. So, those are exceptional videos. I'd say that you just go through them once. So this is a rough outline. It need not be the same way in your college, but you can just go through that. In clinical cases, you'll have one long case for 50 marks, two short cases for 25 marks each. So you'll have a case from CNS, maybe a stroke or hemiparesis. Then from respiratory medicine, you'll have pneumonia or pleural effusion. From gastro, you'll have a case of cirrhosis or alcoholic liver disease, and so on. OSCEs, again, you'll have spotters, scenarios, communication, if at all a patient, requires ventilation, ventilatory support, how do you counsel the patient's family that the patient needs ventilator, the complications associated with it, and so on. Again, it is just a basic outline. You can ask your seniors, for more information about practicals. So, summarizing what the students struggle with, all in all, in a nutshell, see, if you feel like there's just too much to study, you need to prioritize. You need not, you need not read each and everything to be able to pass your exams or even score a distinction. So focus on the previous year questions, then focus on the extra topics that you're supposed to cover. And if you're forgetting after studying, like I said, you'll have to keep revising it because there is just too much to remember. And if you just give it one reading and then leave it for the final exams, then you won't be able to remember it again. Again, it is just a basic overview of what the students struggle with and some solutions that I believe will help you. Again, this is a summary of my entire presentation. What I would do, if I were to start my final year again today as a final year student, first I'll get all the previous year questions and divide the syllabus by systems. Then obviously I'll go through the T1 topics, the must know topics, because there are certain important topics which repeat almost every other year in medicine. Then pick one primary resource, don't jump from resources to resources. In the beginning itself, take your time, go through all the commonly available resources, ask your seniors for their advice, take your time reading and understanding each and every resource. It will obviously take you some time, but again, once you understand what suits you the best, you can spend your entire year studying directly from that. Instead of having to change to an entirely new resource just before your finals. Then obviously start revision immediately. If you've studied a particular system, don't directly jump to the next system. Revise what you've read first. Because the moment you jump to the next system, you'll keep on forgetting the topics from the previous system. And obviously practice your previous year questions and do not neglect clinical postings, because it will not only help you in your practicals, it will also help you reinforce what you're studying in your theory exams. And let's say there's a case of MI that appears in your exam. So if you have not attended your clinical postings, you'll just be able to write, the textbook knowledge, whatever the textbook gives you. But if you do attend your clinical postings, you see the patient, you perform the bedside test, you'll be able to remember the small details. The dose of aspirin, be it 75 to 325 mg, whatever it is. Why tenecteplase is preferred over the other drugs, and when you should be performing thrombolysis and when you shouldn't. These things are, the details which you will remember if you see the patient directly yourself. You'll forget it very quickly if you read it directly from the textbooks. So all in all, I'd say this is the basic approach that you can try because, but it is never impossible. It's never impossible to, score a distinction. Yeah, that is pretty much it from my side. Jazakallah khair. Obviously, medicine being a vast subject, there's a lot to cover. This is just the basic summary of what is required for you as a final year student. I know there are many things that are left that I couldn't cover, but you can, you can always come in touch with me and ask me questions if you have any doubts, inshallah. Jazakallah khair.
Jazakallahu khairan, Dr. Salman sir. Inspiring to hear from someone who has walked the same path and is willing to help those following behind. Jazakallahu khair for so much for sharing your journey with us. Your honesty and valuable tips will undoubtedly help us navigate our final year with greater confidence. May Allah subhanahu wa ta'ala reward you abundantly. Our second panelist is Dr. Khatija Fatima of Medicity Institute of Medical Science, batch 2021. Ma'am has achieved a distinction in obstetrics and gynecology, and inshallah, she will be guiding us through it. A warm welcome to you, ma'am.
Assalamu alaikum everyone. Am I audible?
Yes, ma'am.
Okay. Just a second, I'm trying to share my screen. So today I'm going to speak on how you can ace OBGYN for your university exams. As you all know, obstetrics and gynecology is a long subject, and it has 200 marks for theory and 200 marks for practicals. That being said, compared to medicine and surgery, it is a comparatively easier subject and you can easily score it. So coming to the paper wise distribution, paper 1 में obstetrics है and paper 2 में gynecology. Resources. So for obstetrics, you can use either Datta or Mudaliar. Both of them are equally good. It depends on your personal comfort level. You can use any one of these. Then for gynecology, you can use Shaw's or Datta or Sheshadri. Shaw is a very standard book. It has a standard language. If you're someone who has used Guyton or Robbins in your previous years, you can use Shaw's. If you feel it difficult, you can always collaborate it with Smart Notes and you can use it. Otherwise, you can use Datta also. Both are equally good. That being said, if you are already purchased some book and you're already referring it, please continue using the same resource. Do not change textbook at this point. Online resources, almost every faculty on every platform is equally good, but I have personally used Marrow because ma'am has explained obstetrics and gynecology in a very easier format, and the way she explains obstetrics is very easy to understand and remember. If you're not watching her videos, at least refer the oncology part of gynec from her notes. The classifications and the staging of cancer is given very easier, and you can also use Marrow notes for revising during your exams. Coming to important questions, there are Times Medical question bank and HAQs. Both of them are equally good, but the main source should be your last 5 to 10 years previous year questions. Last minute resource, Smart Notes. That being said, please read your textbooks and then rely on Smart Notes. Using only Smart Notes as your main source is like waste. How to study? First, you need to watch some lecture. It can be a university lecture or your textbook online lectures, Marrow or Flipchart or whatever you're watching, and then followed by reading textbook. This will help to build the concepts. Please do not skip textbook reading. This will give an idea of how to present the answer in the exams. Learn by memorizing and writing the answer. So whenever I used to study a topic, I used to have a rough book beside me, and after reading a topic, I would just write it in rough, whatever I could remember of the same topic, and then I could know where are the gaps in my memorization. With that technique, I would know what gaps are there in my memorization, and I would next reading I would read the same thing. So this you understand, my revision would get easier. And do active recall. I know oncology is a little difficult to remember, like cervical cancer staging, endometrial cancer staging, ovarian cancer staging. These three are there, and it is very volatile. So please do active recollection and multiple revisions. It will be easier for you to remember. Revision is the key of memorization. Next paper presentation. Even if you have good knowledge, if you cannot put it in your paper, it is of no use. So these are some points I would like to recommend you guys. First, neat and legible handwriting. इसका मतलब ये नहीं है कि you have to use some glitter pens or some colorful calligraphy handwriting. Just black pen and blue pen for side headings, and then no, write in legible handwriting. Write in the format of heading and subheading. This will give structure to your paper, and it will be very good. Write the section in which you are most confident with first. Then draw flowcharts and diagrams whenever it is required. Present the answer in systemic format like definition, etiology, clinical features, complications, investigations, and management. Write in points. It will be easier for you to write also, and the examiner also, it will be easier to read and award you marks. Attempt all the questions. Please do not leave any question unattempted. Time management. Please allot a particular time slot for each section. Like you can always give like 1 hour for LAQs, 1.5 hour for SAQs, and half an hour for VSAQs and MCQs. That's it for theory part. Now for practicals, please do not ignore practicals. It carries equal weightage, and it is easier to score in practicals also. So you can prepare it for practicals by attending a clinical postings. Please take cases and present in your clinical postings. This will help you to know what mistakes you are doing while presenting, and it will give you a confidence in your final viva also. Learn the obstetric examination, and also you can watch White Army discussion videos on YouTube. These are also good. These are the list of some obstetric and gynecology cases. These are the standard cases. It might vary from college to college, so please ask your college seniors about it. Apart from cases, you will also have OSCE, drugs, instruments, specimens, spotters, process of NVD, maternal pelvis, and fetal skull. For these, you can watch videos on YouTube also. Please ask your seniors what drugs, instruments, specimens are kept for you, and make a PPT, PDF, and keep it in your Telegram or WhatsApp. It will help you from preventing and collecting resources in the last minute. Practical textbook. There all the textbooks available are all equally good. You can use Datta or Sharmila and Babu. You don't need to necessarily buy the textbook. A soft copy of it will also be enough. To summarize my session, I would like to say that take one resource for ops and one for gynae and read it multiple times. It is better than following multiple resources and reading it one time. PYQs are your roadmap. Follow your PYQs, stick it in the question bank, stick it in the textbook, and while reading, you will know okay, what you have to read and what things you can skip. Practice writing answers like I have told you earlier. Present the paper well, attend your clinical portions, and do not ignore preparing for final practical exam. Stay consistent. That being said, believe in yourself, study regularly, and inshallah, you will ace it. You have come this far, now finish strong. You are one step closer for the doctor prefix. Jazakallah.
Jazakallahu khairan for such insightful words, ma'am. Your experiences and practical advice have certainly given us a clearer perspective on what lies ahead. We truly appreciate you taking the time to guide us. Indeed, we all now look forward to our self improvement in the spaces we lack. Jazakallahu khairan, Dr. Khatija Fatima, ma'am. Our third panelist for
Moise,
today
Idra.
Our third panelist for today is Dr. Syed Mustafa Aizaz of Dakhan Medical College of batch 2021. Sir has secured a distinction in ENT and obstetrics and gynecology, and inshallah, he will be helping us master ENT with his experience and practical approach. A very warm welcome to you, sir.
Jazakallah khair for the introduction. Assalamu alaikum wa rahmatullahi wa barakatuh and good evening everyone. I'm Dr. Syed Mustafaddin Azaz and today I am here to share with you a simple and practical strategy how to get a distinction in ENT. First of all, I want to tell you one thing. ENT is not a difficult subject. If you study it in right way, you don't need to read 10 different books or study everything in extreme detail. You need one book, one source, proper understanding, repeated revision, good understanding, presentation, regular practical and viva practice. Your main source should be Dingra. Use Dingra as your core ENT textbook. Do not read passively, read actively regarding the classification, clinical feature, investigation, and management. Close the book and try to recall the key points given in it. Convert difficult lists into the tables or flowcharts or diagrams. Use previous question to identify what needs repeated revision because on repeated revision you will retain the topic. Avoid resource overload. Add concise notes or review material for rapid revision. Use lectures and videos only to clarify the difficult concepts. These are the few important questions during my exams. These are the questions from the disease of the pharynx, ear, nose, and larynx. Few essays, important LAQs. Regarding the syllabus, ENT consists of only one paper which is of 100 marks and practical paper is of 100 marks. Regarding the source for online, you can use Marrow, but Dingra is the main source. It is a very beautiful book and very easy book to understand regarding the concept for exam. Regarding the question banks, all question banks are similar. You need to follow the PYQs or HAQs. I have personally followed the questions of Muhammad Nurul Huda. 15 years are enough for me. Rough list of cases for the practical purpose. For my college, I am from Deccan Medical College. In the DNS, CSOM, chronic tonsillitis, or putone plus putone audiometry, X-rays and instruments. Regarding practical, you can understand more from your seniors. Now, regarding how to study every topic, first study topic from definition, introduce itself, then study the etiology, only the core points, not to go in detail, etiology and the risk factor, then study the clinical features, then the investigation, basic investigation regarding the topic, then the differential diagnosis and the treatment and complications. How to master the high yielding areas, like in ear we should know the anatomy, basic anatomy of the ear. Hearing tests like Rennes test, Weber test, otoscopy, CSOM, otosclerosis, hearing loss, facial palsy, vertigo, and mastoiditis. These are the few important topics from the ear. From nose, epistaxis, DNS, rhinitis, sinusitis, nasal polyps, and allergic rhinitis. From throat, tonsillitis, adenoid, dysphagia, swellings, infection. From pharynx and larynx, the examination, voice disorder, laryngeal lesions, and the airway emergencies. Head and neck. From head and neck, you need to do the common tumors like pleomorphic adenoma, lymph nodes, and clinical examination. How the people are different for distinction minded. They are consistent, they are disciplined, they are confident. First of all, we should know the concept, understand the disease, and revise it multiple times, recall itself, and how you present. Write the structured answer, not in a paragraph manner. Regarding the practical, you should know the cases, instruments, viva, and clinical examination. How I practice, I am sharing my personal experience regarding practice 2 LAQ plus 6 SAQ and VSAQ style recall method. After this, you recall. Understand before memorizing, because before memorizing, if you understand it, you can memorize it easily. Treat practicals and Viva as scoring opportunities. If you score good in practicals, your overall score increases in ENT and your chances of getting distinction increases. And if your marks increase in ENT, overall chances of getting a distinction increases. Use diagrams, flowcharts, and tables. Revise repeatedly. If you revise repeatedly, and you can retain it very nicely. Retention beats one-time reading. The secret diagrams. You do not need to be an artist. Your diagram just need to be large, clean, simple, and properly labeled. Whenever the diagram gives the additional information, draw it. Use flowchart for the management and pathogenesis wherever appropriate. A good diagram can make you answer such more attractive and easier for the examiner to assess. These are the four common ENT symptoms for ear, nose, pharynx, and larynx, which can be used in almost multiple answers. From ear, it is pain, discharge, hearing loss, tinnitus, and vertigo. From nose, it's obstruction, nasal discharge, epistaxis, loss of smell, or sneezing. From pharynx, it is sore throat, dysphagia, odinophagia, foreign body sensation. From larynx, harshness, stridor, curve, dyspnea, and dysphagia. These are the few common ENT symptoms that can be used widely in almost every answer, so that you can present your answer well in exam. Now comes the most important point, how you present your answer. Start with a definition or start in a short introduction. Use clear heading and subheadings. Write in point instead of long answer. Underline important keyword and add relevant diagrams and flowchart. For clinical presentation, follow this order I have given below. Write the presentation, then examination, then investigation, then the diagnosis and the treatment. Regarding the practicals and viva, more appropriately, your seniors can guide you in your before the exams. Commonly, we need to focus on the topics like ENT instruments and state their uses, practice otoscopy and tuning folk test at home. Know ear, nose, and throat examination pattern, how through your Dingra's practical manual. Revise common viva questions, answer directly, stay calm, think quickly, clinically. This is my personal 7-day revision cycle. Cover these major topics and active recall set on day 1. On day 2, deepen the concept and make short notes. From day 3, you can concentrate on practical, then revise the diagrams. On day 5, you can solve the past PYQs papers, then full length test and analyze yourself and identify the weak area and boost your confidence and then represent it. Your 30-day distinction plan could be like this. In week 1 on year, you can focus on the year, on the concepts and the diagrams and the clinical examination. On the week 2, you can focus on the nose and nase and paranasal sinus. On the week 3, throat, larynx and head and neck. On the week 4, past papers per practicals plus viva and full revision. Every day you need to do a 30-45 minutes of recall, a 15 to 20 minutes diagram. Inshallah, you will do all the good. The night before the exam, this is the most important point where students fail. Do not start new textbooks because it may cause difficulty to you. Revise your marked and high yielding materials. Revise diagram classification, science and management. Sleep properly because at least 2 hours of sleep before exam is very necessary for fresh mind to recall the answers and to represent your answers very well. Enter the exam with a plan, not panic. Be calm, confident and positive. Inshallah, you will do great. Exam health strategy. First of all, have tawakkal on Allah. Start with Bismillah. Read the paper carefully. Start the questions you know best. In which part you are more best in LAQs, SAQ, and VSAQ. In whichever part you are best, try to represent it very well. Budget time before writing. For LAQs, I will provide one. I will give 1 hour. For SAQs, I will give 1.5 hour and half an hour for MCQs and VSAQs. Leave space for the diagram. You can draw it in the last. Attempt every question according to the required format. Do not leave any question because it gives the chances of scoring. What toppers do differently? They follow one book, they understand, they practice, they revise, and they present well. Inshallah, you will get distinction. Staying consistent instead of depending upon the last minute study is important. Before closing, I want to say, I want you to remember one thing. Distinction is not about studying 15 hours a day. It is about studying consistently and studying smartly. Don't compare your preparation with someone else because it may cause you panic. Make a plan, follow it every day, revise repeatedly, and practice your presentation. Have confidence in yourself. Stay consistent, stay disciplined, stay confident, and remember that you can do it. Thank you everyone for your attention. All the very best for your ENT examination. Jazakallah khair.
Jazakallahu khairan, sir. We sincerely appreciate your thoughtful guidance and encouragement. Your words have been both motivating and reassuring. Your advice, encouragement, and willingness to help mean a great deal to all of us, and we are grateful for your willingness to support your juniors. Jazakallahu khairan, Dr. Syed Mustafa Aizaz, sir. To keep your momentum going through this final lap, IMSA is excited to announce the Al Falah Study Circle. It is a dedicated space built for your batch to study together, stay consistent with group accountability, and ongoing guidance from our seniors. The Google Form link has already been shared in the general body group. Al Falah Study Circle is here to walk this journey with you. We invite every single one of you to fill out the form and join. Alhamdulillah, we have now reached the interactive part of today's session. Knowledge grows through questions, so don't hesitate to ask anything that can help you become better prepared. I now invite our participants to post their doubts and questions in the chat, and our respected panelists will be happy to answer them.
Okay, I can see a few questions on my screen. Firstly, somebody's asked, using textbook as a primary source of information is best, but it's August until now was totally relying on video lectures. How to start with textbooks? Okay, see, it is never too late to start with the textbooks, really. The problem with it is if if you aim to cover the entire textbook when you're starting, then obviously it is not possible. Uh, like I said, prioritize only the previous year questions. You can cover that from the textbook, right? It won't be that big of a burden. So you need not read each and every page or each and every line from a chapter. Just go for the PYQs at least. Because video lectures, they're only there to help you understand the concepts. You won't be able to directly make an answer or write it directly in the examination, even if you watch a lecture. Okay, next, having not studied medicine or any other subject uh, for the past months, but still adamant on studying from the textbooks, Davidson's guy. See, Davidson's is too vast. Again, even if you're using Davidson's for certain topics, then maybe that will be useful. But again, like I said, Archit Balur is everything that you need to know, to be very frank. Because what is in Davidson's that is not given in the Balur? I ask you. It is the mechanisms, the details, the mechanisms which Davidson explains, which are lacking in Archit Balur. But to be honest, you cannot even remember that. Even if you read, all the detailed mechanisms. If you see Harrison's in the fibrinolytics, I suppose, in the hematology section, they've given all the detailed molecular explanations, how the drugs work, how they interact with the histone proteins, how they modify the histone proteins to, to bring about the actions. But you don't really need that, uh, neither for your theory papers nor for your practicals. So why do you want to spend your time, understanding the detailed mechanisms which are not going to appear anywhere in your test, rather than, studying some other topic which is important for you? OPGAI is doable. To be honest, OPGAI is not at all scary. And my friends who had studied from Arun Babu regretted studying from it 3 months into our final year, because it is just a compilation of facts, uh, especially the Arun Babu. OPGAI is way more conceptual, is visually appealing, has more diagrams, I'd say. Only the CVS part in OPGAI is a bit complex, so for CVS, you can refer to some other resource, even notes, I'd say. But apart from the CVS, every other chapter in OPGAI is doable.
I got a question from Muhammad Ibrahim that he has done almost all of ENT except the ear part and feel exhausted now. Regarding this, I want to say that ear is also a very small part. Don't consider as it a major part. Study the anatomy part, understand its diagram, and inshallah you can do it. There are few LAQs. Concentrate on that part, then do the SAQs and the VSAQs. You can do you if you can't understand the anatomy, if you are facing difficulty in understanding anatomy, then make some notes or understand it through some online lectures or videos. There is no need for making any particular notes, because Dingra is very simple and easy to understand book. You can just understand its etiology, mark the etiological point, then understand the symptomatical uh, presentation of the disease, then the treatment is given in the last. Understand that the highlighted points given in diagram. This is how you can present the answer very well in exam. If you're not clear, you can ask again.
Okay, somebody has asked, everyone emphasized on the importance of revision, but it looks difficult to complete the syllabus even once. See, that is what I've said, right? If you try to finish the entire syllabus first and then try to revise everything, it is not going to happen, to be honest. Because clinical subjects, there's just too much to cover. Even in your first reading, you won't be able to revise it again. So break it down, like I said, uh, pertaining to general medicine or even some other subjects. If you have completed one particular system, revise it again, go through the entire system once again, instead of jumping directly to the next chapter, trying to cover the entire textbook once, and then, aiming to revise everything from the basic again, from the beginning. That is counterproductive. The moment you read two chapters and switch to third chapter, you'll feel like you forgot everything from the previous two chapters. So that is counterproductive, and that is why you have these internal assessments, right? For internals, the portion you have is limited. So even you can use even your internals, for your help. The moment you're done with your internals, first or second internals, go through the entire syllabus again. I know it is very difficult. During the exams, our main focus is just to get over with it. But take a day off if you want, take some rest. This is what I used to do, to be honest, in my previous years. I did not do it very often in my final year. But the moment I was done with a particular internal, I used to go through the entire question paper again. I used to compare my level of preparation with the type of questions that were given in the paper. And then I used to revise everything that I had missed from the question paper. So it will help you reinforce your knowledge. If you try to cover the entire syllabus first and then try to revise everything from the first chapter, it is a vicious cycle. You'll keep on reading the chapters and keep on forgetting them. So it is not useful.
Someone asked me about regarding larynx. You need to study the total larynx part, or the important questions are enough. Regarding larynx, your important questions are enough, but you should have a simple idea, at least a basic knowledge regarding all laryngeal diseases, because sometimes we can get a bouncer. So, regarding to get good marks, study the PYQ questions. It's enough. If you want to score more and more, you want to know gain knowledge, then you can go for all the part given in larynx. But important questions are enough from my side.
Okay, somebody's asked about the drug dosages. Okay, sorry for that. Yeah, somebody has asked about the drug dosages. See, you need not remember dosages of all the drugs given in your textbook. There are, certain clinical conditions where even the dosages are easy. Like I said, for myocardial infarction, there is also mnemonics given in the textbook. You have Monash, morphine, oxygen, and everything. So the common drugs, like I said, that is why, do attend your clinical postings. When you attend your clinical postings and go through the patient's reports, you will see that the dosages for certain drugs are common for different clinical conditions. Be it prednisolone 20 mg, or sometimes increased to 40 mg. Aspirin, you have 75 mg, or be it tenecteplase. Atropine, if you're using it for tachycardia, if you give it less than 0.5 mg IV, it will cause bradycardia. It will cause paradoxical bradycardia. So you will have to give more than 0.5 mg IV atropine to control tachycardia. So you can remember only the important conditions. You have anti-snake venom and other things. So you need not go through the entire doses that is given in the textbook. You won't be able to remember it.
Regarding the question, someone is having minor postings, so he's able to do only ENT, cannot do ophthalm. My personal opinion, which I followed, is 2 hour pattern of studying. I studied 2 hours for ENT, then gave a break of half an hour, then studied ophthalm. In which I personally shared the plan for 2 hours, like two LAQs plus six SAQ and VSAQ pattern of studying. So regarding from my side, you can do ENT for 2 hours, then opthal for 2 hours, and these are small subject compared to other subject. If you score well in this subject, you can get great marks. So do not neglect these subjects and focus on this subject. And someone is asking that they have to study the paper one for 1 week or paper one subject for one day. It's totally depend upon the student how they want to carry the subject. Somebody are interested to complete subject in 1 week, they can follow. But few get exhausted by reading one subject and cannot concentrate on one subject continuously. So it totally depends upon the students how they can follow for representing themselves for studying subject. For like I personally prefer 2 hour strategy plan. If you feel comfortable, you can follow this. If you don't feel comfortable, you can try some another approach.
Okay, somebody's asked which topics to watch from Marrow and what to skip at this point in medicine. See, the problem with Marrow is the explanations are, very detailed. And obviously, it is for your NEET PG preparation. It is aimed at your PG preparation and not the university exams. So you just take the topic of asthma, for example. When you go through the Marrow lecture on asthma, there are a lot of details which are not necessary for you for university exams. The latest GINA guidelines, Global Initiative Against Asthma, the latest GINA guidelines, their revisions, all the SABAs and LABAs, patients with different severity. You really need not know all those things for your university exams. You just need to know the drugs, their dosages, and the treatment of complications. That's it. Um Whereas if you're preparing for NEET PG, you need to know, the drugs, the dosages used in different severities. So that is where, the discrepancy between NEET PG preparation and the university exams becomes very obvious. Uh, so that is why Marrow is not really preferred by many students for medicine. You can go for Dr. Deepak Marwa or Dr. Tamim Saif sir, like I said. And to be honest, if you're aiming for university exams, like I said, even the Medi Lectures channel in YouTube is really good. Uh, Achit Balur is in fact like a brief summary of Harrison's. And like I said, Medi Lectures, they offer summaries from Harrison's directly. And to be very frank, I have personally used Archit Balur, like I said, and I even watch, international channels. I watch lectures from professors of other countries too. And most of the time, it is very similar to what is given in Archit Balur. You won't find a lot of deviation from what is given in Achit Balur. That is why I have emphasized again and again that you stick to Achit Balur, and it is basically a summary of Harrison's. And if you want some online resource to correlate with it, in YouTube, like I said, you have Medi Lectures, which closely resembles Achit Balur. If you want to go for some other PG preparation platform, then Dr. Tamim Safsar or Dr. Deepak Marwa would be my preferences. Marrow would be a bit too much to cover at this point. Regarding Mantapa textbook, see, it is nice, but it is not enough. That is the only problem. Certain answers given in Mantapa are really good. It covers everything that you need to know. But the problem is there are certain questions which are very, complicated or which need a detailed understanding and explanation. For example, if you're studying cirrhosis, or if you're studying hepatic coma. So in the Mantapa, they've directly given the treatment, but they've not explained the rationale behind using those drugs. So why would you use lactulose in a patient of hepatic encephalopathy? It is basically a purgative. It is to decrease the absorption of ammonia, because ammonia again crosses blood-brain barrier and everything. So these explanations help you understand the topics. And if you read them even once and do not revise them effectively, you will still be able to write at least something in your exam. Whereas the problem with books like Mantappa is, even if you read them once, you won't be able to remember them for a longer time because you just read those facts. You didn't understand the concept. Okay, system-wise priority for general medicine. To be honest, there is no system-wise priority as such. Like I said, go for the topics, go for the previous year questions. Like I said, don't chase the chapters, chase the topics. There is no particular system from which almost all the questions get asked. So, like I've displayed in the screen, you have myocardial infarction or acute coronary syndromes. There is diabetes. So, for 21 batch, a long question was asked on diabetic ketoacidosis and management. Then you have, nephritic syndromes, pneumonias, all those things. So, go through your PYQs. go through the PYQs and make a priority list by yourself. Psychiatry and dermatology, it is not going to take a lot of your time. One thing that I'd like to emphasize here is, if you are not a good student, pharmacology in your second year, then you'll face more difficulties compared to your peers. With medicine is nothing but the culmination of the second year subjects. So I had faced the same problem, and many of my peers did too. Because even in psychiatry, you're supposed to write about the drugs, especially psychiatric drugs. Not a lot of people study, so that is where it poses a problem. So do revise your pharmacology a bit well. Dermatology is very easy, to be honest. Just give it a reading. Inshallah, you'll be able to remember it. Psychiatry needs a bit more effort compared to. Okay, there's a question from Obigain. Lectures for derma and psych. Personally, I won't recommend watching lectures specifically for derma and psych. If you have any platform and if you're preparing for your NEET PG, then just go through them. Have an overview. You also have this Farid series by Physics Wala on YouTube. So even that is good enough. I'd say I have watched it for both dermatology and psychiatry. Derma is a bit good, psych not so much. But if you're aiming for your university exams particularly, then instead of watching lectures separately for short subjects like derma, ortho, or psychiatry, you can just go through the Farid series, by Physics Wala on YouTube. Okay.
I just want to
How
add up.
to effectively complete medicine? Yes, please.
I just want to add up. Just don't lose focus over the minor subjects like ENT, ophthalm, and pediatrics, because these are scoring subjects. If you score well in this subject, the overall score your in memo increases, and your chances of getting distinction overall increases. Kindly focus on minor subject also. Jazakallah khair.
Okay, which systems to follow from Archit Buller? To be honest, all of them. Again, like I said, for pediatrics, CVS is a bit more complicated in Archit Buller. So maybe for CVS, and in toxicology, like I said, a few of the poisonings are missing in Archit Buller. So maybe for toxicology and CVS part, you can refer to Mantapa exam prep manual. But for rest of it, like I said, Archit Buller is really good. You'll find it difficult during your first reading, to be honest. But again, like I said, to make you feel a bit better, I'd say even I started my medicine preparation late, quite late, to be honest. But still, I managed to get distinction in my paper one, and near distinction in my paper two, theory in medicine. So it is doable. Yes, obviously you can use ChatGPT, but see, to be honest, not gatekeeping anything. There were questions in the exam. which I had searched just in the morning in the chat GPT and read it directly from the chat GPT, and the same questions had appeared in many papers. So the problem is not the tool, but the prompt that you give the tool. So you have to give it the best prompt possible. So you can ask it to give the explanation from the standard sources of literature of medicine or something, or you can ask it for the summary from Harrison's or something. And you'll also have to cross check it once, because it is not it is not correct most of the times. But again, if you're short on time, then obviously you can start using ChatGPT too. Okay, no, reading all the reading subjects one by one and keeping it aside and then starting with the other subject, it is totally counterproductive. Again, like I said, I just told that, in even in a single subject, if you read a chapter once, then immediately switch to the other chapter without revising the previous chapter, you'll end up forgetting the previous chapter. So again, when you come to it, you'll feel as if you're starting it from the scratch. So, trying to complete an entire subject first and then switching to the next subject, you'll end up, you'll end up forgetting everything. So, personally, try to read at least two subjects every day, because you have just too much to cover. What my friends and I used to do, we used to combine one long subject and one short subject. So, a major and a minor subject. So, let's say if you're studying OBG, you can combine it with pediatrics, or if you're studying medicine, you can combine it with pediatrics. If you're studying surgery, then you can combine it with ENT. Opthal maybe with orthopedics or something like that. So you can come up with your own combination, because if you try to study two major subjects in one go, you won't be able to remember much of it, and it will feel too overwhelming. So I think this is pretty much it. That covers the basic summary. Again, there's just too much to explain or understand about medicine. A single session of 30 to 40 minutes is, to be honest, not enough to cover everything that is needed for university exams. But again, like I said, if you still have any doubts, you can always reach out to me. I'll be more than happy to help, inshallah. And even the other speakers, would like to help with their respective subjects. The first thing I'd say, take home message, would be to have confidence in yourself, have faith in yourself. Like I said I started very late, but still, I ended up getting first class in all the subjects. I had switched resources because I didn't pay attention to it. That is why I told you to take your time, going through all the resources in the beginning itself. Stick to one resource so that you don't have to switch to a completely new resource just before your exams. So do not repeat the same mistakes. Have faith in yourself and just give it a try. Like I said, switching immediately to the notes or something is just limiting your potential. And if you don't have confidence in yourself, then who else would? So have a bit of faith in yourself. Be confident that you will be able to cover it. And if you genuinely start liking the subject, it will definitely become easier for you, inshallah.
Alhamdulillahi Rabbil Alameen. As we come to the end of this wonderful guidance session, I would like to express my heartfelt gratitude to our respected panelists. Despite your busy schedules, you took out your valuable time to guide your juniors, share your experiences, and simplify subjects that often seem challenging. Your willingness to help truly reflects the spirit of service and mentorship. On behalf of the academic committee of IMSA, and every student present here today, we sincerely thank you for your time, your efforts, and your valuable guidance. May Allah subhanahu wa ta'ala reward each one of you abundantly and place immense barakah in your knowledge, grant you success and the hereafter, and make every student who benefited from today's session a means of ongoing reward for you. Jazakumullahu khairan to everyone for joining us today. May Allah subhanahu wa ta'ala bless you with all beneficial knowledge, success in your final prof exams, and make us among those who use our knowledge to serve humanity with sincerity. Before we officially conclude today's session, we have a small request for all our participants. A link to a brief feedback form is being shared in the chat right now and will be sent in the group. Please take a quick minute to fill it out before you drop off. Your feedback is extremely valuable to us, as it helps us understand what worked well and allows us to continuously improve our future sessions to serve you better. Inshallah. اللهم إنا نسألك علما نافعا ورزقا طيبا وعملا متقبلا. O Allah, we ask you for beneficial knowledge, pure provision, and deeds that you accept. With this, we come to the conclusion of the final lap. Thank you for joining. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. السلام عليكم ورحمة الله وبركاته.